If you've been waking up with tingling fingers or wrist pain and think that it's from just typing too much, you're not alone. But what if I told you that carpal tunnel syndrome can sometimes be the first clue to something much deeper, like hormonal changes or even active rheumatoid arthritis? I'm Dr. Bhanusali, a rheumatologist who treats joint pain, and today I'm walking you through the 5 causes of carpal tunnel syndrome that many people, including some doctors, overlook. Carpal tunnel happens when the median nerve, which goes right here, is kind of being squeezed, gets compressed as it travels through a narrow space in your wrist. That nerve controls the sensation in your thumb, your index finger, your third finger, and when it's squeezed, you get symptoms like numbness, tingling, burning, and even a weakness in your hand. And actually, if you're starting to see kind of a change, this should be a little bit meatier over here by the thumb. But if you're starting to see a change in the muscle tone there, definitely time to stop ignoring it. So what are these 5 causes? Number 1, repetitive motion. We've all heard that maybe typing too much can cause carpal tunnel syndrome. And yes, repetitive motion matters. But it's not just about how much you're using your hands, but it's how you're positioning them. I see it in people who are gardening, cooking, or even sleeping, but with their wrist curled in. Try this. Check the position that you're scrolling. When you're doing your doom scrolling at nighttime, look at the position of your wrist. Is it kind of being compressed like this, or even when you're sleeping? Because if it's bent at that angle, it might be making your symptoms worse. Number 2, inflammation, like rheumatoid arthritis. Carpal tunnel can be the first symptom that you actually have an underlying autoimmune disease like rheumatoid arthritis. Or if you know you have RA, it could be a sign that your RA is active. When you have inflammation at the wrist joint or at the tendons around it, that kind of shrinks the space that's around the nerve, and it gets squeezed and you get symptoms. I've seen this before in people that have had carpal tunnel syndrome, maybe on one side or both sides, or even carpal tunnel surgery, and they're wondering, why do I keep getting carpal tunnel again and again? And eventually they're diagnosed with something like rheumatoid arthritis. The good news is if we treat the RA, that usually controls the symptoms. So if you're suspecting it, see a rheumatologist, because if you're having actual RA, you don't want to keep getting surgical intervention. You want to treat the problem, the underlying autoimmune disease. What about hormonal shifts? Menopause or pregnancy. Estrogen affects your connective tissue and how your body is holding on to fluid. That's why so many women experience carpal tunnel syndrome when they're around pregnancy or even during menopause. Even subtle fluid shifts or soft tissue changes can compress the nerve, and the timing often confuses people. What about carpal tunnel syndrome and blood sugar or diabetes? Carpal tunnel is more common in people with diabetes or even pre-diabetes. When you're kind of teetering on the edge and your doctor has told you that you're on the borderline, even then you're at a higher risk of getting carpal tunnel syndrome. High blood sugar can damage those small nerves and thicken the connective tissue, which makes the compression of that nerve more likely. Even if you're not doing any repetitive motion, people tell me I don't really type much, I'm not really doing much with my hands, why do I have carpal tunnel syndrome? But there are some silent conditions out there like diabetes that contributes to it. So if it's out of the blue and you don't think you're doing anything that's caused it, definitely go ahead, see your doctor and have your blood sugar checked. As well as that 3-month test, the hemoglobin A1C, because that's more of an average and can tell you a lot of information, even if your blood sugar was wonderful for that one day that you tested it. How does the thyroid affect carpal tunnel? Well, when you have hypothyroidism, when your thyroid is sluggish, that can lead to fluid retention, which of course narrows that carpal tunnel. And oftentimes when your thyroid is not balanced and you're using medications to balance it, you're gaining or losing weight rapidly, and that can change how much stress and pressure that your little wrist is under. If you're feeling more puffy or even sluggish lately, and you have wrist symptoms, thyroid testing can be a smart next step. When is it not carpal tunnel? Well, like we said before, usually carpal tunnel is the first 3 fingers and a little bit of the 4th. Now, all of a sudden, if it's your pinky that's having this numbness, tingling, it could be compression of the nerve in a different area. So it might not be over here where your median nerve is, but it could be where your ulnar is, so right about here. Or it could be further up. Don't forget, another important area is the neck, like a pinched nerve in your cervical or C-spine, or even having something called thoracic outlet syndrome. That can also mimic these symptoms. That's why the pattern of numbness really matters, especially when somebody comes in and they have it on both sides. and they have some further up symptoms as well. They're feeling a lot of discomfort. We also always like to look above that, so somewhere like the neck, to see if that's an issue. So if you've been brushing off your symptoms as just aging or just overuse, I hope this helps you see the bigger picture. Also remember, if you have severe carpal tunnel syndrome, you can get wasting away of this muscle. The medical term is atrophy, but really it's just shrinking of this area, and you're losing this muscle mass. You can see a kind of a dent over here, and that can be permanent. Sometimes it's reversible with aggressive treatment, but oftentimes it's not. So before it gets to that point, you really want to evaluate. If you want to follow a video on treatments that actually help, from wrist braces to lifestyle strategies, let me know in the comments. And if this video helped you think differently about your symptoms, please follow and share with someone else who might benefit. Dr. B with Plant Forward MD. I'll see you next time for more insights on arthritis, autoimmune health, and staying strong as we age.